Welcome to Nurses and Midwives Talk with Ruth or She Can Do, celebrating nurses and midwives in 2020, the year of the nurse and the midwife. On today's episode, we have got Edidiong Asanga, a nurse midwife who uses the American Sign Language and the Nigerian Sign Language to care for hearing impaired patients. This is very innovative as she's the first in the state and South Nigeria to do so. She travels to different hospitals within the state and outside to ensure that hearing impaired patients receive the needed care by mediating between the patients and the medical team. Edidiong does advocate for accessibility and affordability for all, including the hearing impaired. Her vision is that every major hospital in Nigeria and low-income countries that cannot afford hearing aids for patients with hearing impairment have at least one sign language interpreter who is a health personnel. Edidiong also demonstrates leadership by taking the lead in training nurses and other healthcare workers in the use of sign language. She's doing this using technology, Zoom, twice a week in order to reach a wider audience, both nationally and internationally. This has helped to reduce the cost of hiring interpreters, thereby making healthcare affordable and accessible, reducing language barrier for these ones. She has set up health or hotlines where hearing impaired persons within and outside Akwa Ibom state can request for healthcare interpreters through video calls only when they are in hospitals, and these services are free. She was recently named as a Global Outstanding Nurse Midwife Leader for the year 2020. She's a source of inspiration to the younger generation of nurses. Edidiong is raising a diverse health workforce. Welcome, Edidiong. How are you?
I'm fine, thank you.
Lovely to see you, fellow Nigerian. So before we start, tell us where in Nigeria are you based? Because Nigeria has how many states now? 36 states, isn't it?
Yes, 36 states. And I am based in the capital of Akwa Ibom, Uyo. Uyo is located in the south of Nigeria and has a population of, I think, a little above 30 million. And as you know, Nigeria is the most populous country in Africa, and we also have a diverse culture. In my state, our main language is the Efik or the Ibibio language, and we also use Pidgin, and English is our official language.
Excellent, fantastic, good. So it looks like you've been up to so much. It earned you an award last year. So I can't wait to hear about all what you've been doing. So let's start from the beginning. Tell us a bit about you, the roles you've held as a nurse, and how you've got to where you are today.
Okay. My name is Edidiong Asanga, and I am a registered nurse midwife in Nigeria. And currently, I work at a special school clinic at the Special Education Center, Uyo, where I employ the use of American Sign Language to care for hearing impaired patients. And before now, I used to work as a surgical nurse and a midwife at the Cottage Hospital in Ibuno. But in 2019, I was transferred to work in this clinic where I currently work. I also train health workers who have interest in the field of sign language and how they can use the sign language, the American Sign Language and the Nigerian Sign Language to care for hearing impaired patients.
Good. So how did you become a nurse? Did you always want to be a nurse? Who inspired you to become a nurse?
From my childhood, I've always wanted to be a nurse. I remembered telling my mom when I was very young that I would be a nurse when I grow up. But a turning point in my life was in the year 2000. I came across an Awake article published by Jehovah's Witnesses. The cover title was "Nurses, What Will We Do Without Them?" For the first time in my life, I read about Florence Nightingale and her contribution to modern nursing. It was quite inspiring. I also read about the experiences of nurses around the world, their challenges, and what motivated them to be a midwife, to be nurses and midwives. There is this particular nurse who mentioned that she is a midwife.
Apologies, we had poor connectivity. Continue, Edidiong. So you read about Florence Nightingale. Yep, continue.
In the article, I read about Florence Nightingale and her contribution to modern nursing. I also read the experiences of nurses around the world and their challenges. I also read about what motivated them to choose nursing as a career. I remember this particular midwife mentioned that each time she helped someone put to bed, it's like she witnessed the miracle of life. And right from that time, I decided that I'll be a nurse midwife. So in 2008, I got the form. I wrote the entrance exams into School of Nursing. I got admission. I proceeded to the school. And in 2011, I became a registered nurse. After then, I proceeded to post-basic midwifery. And in 2014, I became a registered midwife in Nigeria. And after then, I think a few months later, I got my first employment and my current employment for now.
Excellent. Oh, amazing. So this article was what inspired you to come into nursing, reading about Florence Nightingale, pioneer of modern nursing. And you thought, why not? And so you trained as a nurse, then you become a midwife and worked your way until you're doing this current role. Training healthcare personnel in American Sign Language and Nigerian Sign Language. Amazing. How does that work? Because I want to get more of an insight into the role. Because here we do have many patients who are either deaf or hearing impaired, and we would have a sign language interpreter. So if you were not doing what you're doing now, who would have supported this patient?
That is a challenge that we are trying to overcome, because we know that a lot of patients, they're hearing impaired, some of them get sick, or their relative who are hearing impaired, they go to the hospital and the doctors and the nurses don't understand sign language. So it becomes a barrier. And if you don't understand what a deaf person is signing, you can't care for the person. So a lot of lives have been lost because of this language barrier. So using sign language enables us to care for these ones. And healthcare is expensive in my country. So hiring an interpreter who is not a health worker is an extra burden on the patient. But with the use of sign language, they come to us. We can assist them. We can mediate between them and the medical team. And we have done that on several occasions, which has yielded positive results.
Amazing. But who funds your service then? Because they don't have to pay for it. And healthcare in Nigeria is expensive. So who pays for your services?
Actually, for now, the services are free. Because I work for the government, I consider that part of my services which the government pays for. So, yeah, for now.
I'm so amazed that what you do is incredible, because you're doing this because you've seen a gap in service provision and you've extended your role, because you're not employed specifically to do this. You do other nursing, duties, but because you've seen this gap, you're not just supporting people, you're also training other personnel so that they can support others. Amazing. No wonder you got awarded for this, named as one of the 100 outstanding nurses and midwives on the globe. Amazing. We'll talk about that in a minute. But what do you love about what you do? What do you love about your job?
One of the things I love about nursing is that it helps me to develop the self-sacrificing spirit. You know, this innate desire to want to care for someone. Nursing helps me to fulfill that desire. And nursing helps me to love people, irrespective of their background, their language, their culture. So this is what nursing helps me to do, develop this self-sacrificing spirit and put the needs of others ahead of my own.
Oh, amazing. Talk about the selflessness, the self-sacrifice. It helps you to show you love people. We don't talk about love enough in nursing. We'll talk about care, forgetting actually caring comes because you love people, that fellow feeling you have for another human being, and you could put their needs ahead of your own and think, how can I make this better? How can I ensure those I serve, the patients in my care, get the best out of this nursing experience? Amazing. Well done, Edidiong. Well done. Now we're going to talk about achievements. And I put this question here because I know a lot of us nurses, we struggle with achievements, yet we make a difference to those we serve. And it's because of our talent, our skills, our expertise, our knowledge, and then plus our selflessness, this care we have for others. And when we expend ourselves in service, somebody notices, and somebody, after noticing, recognizes us for the great difference we make. So what have been some of your greatest achievements, or whatever you choose to call it? Because you said, I don't know if I want to. Can we reframe the question? Well, I'm using the same question. You choose to answer the way you see fit.
Okay. One of my achievements that is very close to my heart took place on January 2019. I was on night off, so I decided to visit my mom, who stays in a local government close to where I was working before. So my mom, I am one of Jehovah's Witnesses. So she told me, let's go out in service. It's one of the house-to-house witnesses that work that Jehovah's Witnesses do. So while going on the house-to-house witnessing, we went to a particular house and I saw a little boy. I think he was about 2 years and he could not walk. And my mom called the boy, promise. And the boy was struggling to eat. Nobody was there with that little boy. He had been abandoned, neglected by the family and called a witch, that he was into witchcraft. And this boy has been sleeping outside for many months. So when I saw the picture, when I saw the boy, I was deeply moved. And I went to the neighbors, I gathered information, and they told me that the mother abandoned the boy, the father abandoned him, and now the auntie abandoned the boy, that they said the boy is a witch. So I immediately got water, I bathed that boy, I asked a neighbor to prepare food for him. And then while doing this, after getting the details, by that time I was doing internship with the Akwa Ibom State House of Assembly. And then I was in this WhatsApp group, our official WhatsApp group. So I sent the details and the pictures of the boy and initiated a campaign to rescue the boy. That campaign became very effective and some non-governmental organizations responded. Even the state government responded. The boy was taken to the hospital and I spent 2 nights with the boy, after which he was transferred to the teaching hospital because of his critical condition. Right now, that boy has been adopted by the state government and he goes to school. He's working and he's healthy. Remembering that incident really makes me feel fulfilled, that I was able to be used by God to rescue that boy from that dying situation. And another one that I also remember came on in January this year when I was named as one of the 100 global outstanding nurse midwife leaders by WHO Women in Global Health, ICN, that is International Council of Nurses, and UNFPA. And that is because of my contribution to the field of sign language. Those incidents are very close to my heart, and they're my outstanding achievements.
Amazing. One of the 100 women in global nurse midwives, and yours is for the difference you make for those who are hearing impaired, in using sign language to ensure their needs are met. And then this abundant young boy. And it's so interesting the things we take for granted in other parts of the globe, how a young child could be labeled a witch and just abandoned. And the care you showed to this young boy, straight away you assisted him, physically bathing him, and eventually initiated this campaign to rescue the boy. Boy was cared for in hospital and has since been adopted by the state government. Amazing. Well done. The care you showed for this young boy. And who knows the impact you would have had on this young boy. Who would have thought, oh my goodness, she's a nurse. They looked after me. And you never know, we may be having a future nurse in the future. Amazing. Well done for all you've done and continue to do.
Thank you.
Last year, the year of the nurse and the midwife extended this year, 2021, as the year of the health and care worker. It has been a very challenging year because of the COVID-19 pandemic. What have been some of the challenges you've experienced working, and how have you responded?
Okay, so the pandemic came and nobody was prepared for the pandemic. We were all taken on our ways by the pandemic. And during the lockdown, because my clinic where I work is within the school premises, it was shut down because there was total lockdown, no schools. And myself and other staff who work in the clinic were redeployed to other clinics where we had to work. And one of the challenges I personally faced was fear of being infected. I was scared that I will get infected, or possibly I will infect my loved ones. And then there's also the poor information system where people still did not believe that there is coronavirus. So having to deal with misinformations, lies was also a challenge. And then lack of protective equipment, which was a major frightening issue. Having to go to work without masks, without those equipment was also a challenge. But in order to respond to these challenges, I first got proper information and training, because information dispels fear. So I needed to get the right information, know details about the novel coronavirus, how it is transmitted, and what we can do to protect ourselves. I followed the protocols, the guidelines provided by the State Ministry of Health, by the government. I also took some online trainings. I used the WHO app. I also used the WCEA app to obtain trainings and also share these trainings with my colleagues. And it was very good. And the little protective equipment that we provided, I tried to use them discreetly. I also tried to improvise, but I was extremely careful. I followed guidelines, and that was what helped me. And some of my friends, nurses and doctors, got infected, but I'm happy to say that none of them died in my workplace or where I worked as at that time. I also want to use this avenue to extend my heartfelt sympathies to nurses and loved ones, their friends and families who may have died during the pandemic or may have lost their loved ones. I believe in the Bible's hope of a resurrection for the dead. That is what has always comforted me. And I know that can also comfort them, that there is hope for our loved ones who have died.
Oh, amazing. Well done. As you said, no one was prepared. This thing just hit us. I think for me, I think when people just had Wuhan, it just sounded so far from wherever we lived. I'm in the UK, you're in Nigeria, you're like, oh, well, maybe it's China's problem, not our problem. And forgetting that people were still traveling around the globe. And before we realized it, each of us, country by country, was affected as people started getting ill, testing positive, and sadly, many people died. In a bid to prevent the spread of the infection, most places locked down. And as you said, when you had the total lockdown, you and your colleagues were deployed to other clinics. And the fear became real because as we saw people get infected and some people die, the next thing is, oh my goodness, am I safe? There's this fear of getting infected. But if we now get infected, what about our loved ones? And I remember this fear was not just real. I lived through that fear until I caught the virus, sadly infected my son. Thankfully, I only lived with my son because I would have infected many more people. And that fear was real for many of us. But there was another virus, misinformation, disinformation, lies, people not believing this thing was real because they couldn't see it, or perhaps they hadn't seen anyone that was affected, making it much more difficult for us to do our work. Then you mentioned the lack of PPE, personal protective equipment, which, we didn't have straight away. And you think, how am I going to protect myself? I love what you said. Information dispels fear. So if I'm not going to be afraid anymore, I need to get the accurate information that I can use to protect myself, protect those in my care. So you did. You embarked on, you were on this mission to get informed and accurately informed. So you did some online training with the World Health Organization app and then the WCA app. What is that?
Okay, it's an app where nurses and other health workers can receive training. I recently, the Nursing and Midwifery Council of Nigeria said that nurses can go get their online training. And if you have a total of 30 contact hours, you can apply for your license renewal. You don't have to attend the physical mandatory professional programs before you can renew their license. And it will last till 2022. So I used those apps, I learned more. I also took trainings on how to use the protective equipment and how to adhere strictly to the safety guidelines and protocols, which was very effective.
Amazing. Well done. And as you said, once you got educated, you followed the guidelines. And even though your colleagues got infected, no one died, thankfully. But as you said, so many people, so many colleagues, so many, in the UK, we're almost 130,000 people that we've lost. And almost 1,000 of them healthcare professionals. So it's not been easy, and it's been a challenge, but we are grateful. And whatever keeps us alive, faith, whatever it is that we look towards to give us the confidence that, you know what, it's not over, we tap into so that we can keep continuing to serve those in our care. Amazing. Well done. Well done. Moving forward, what is your biggest wish for us as nurses?
The year 2020 was named the year of the nurse and the midwife, and then the pandemic came. But one thing remained very clear, that the status of nursing was raised. I also noticed that the nursing now was campaigning to raise the status of nursing. We faced a lot of people say a lot of bad things about nurses, but people during the pandemic saw that nurses showed resilience, they showed strength of character. despite the pandemic, they were in the front line fighting, caring for loved ones, irrespective of their background or wherever they are. I am so proud to be a nurse. Yes, I want to wish that the status of nursing continue to be raised and that people get to recognize the work that nurses do, and not just recognize the work that nurses do. Nurses also deserve to be, we don't just want the applause. Nurses deserve to be compensated for their hard work. They raise the pay. So I still want to wish that the status of nursing continues to be raised until we reach the peak of where we want to be. That's my wish for nursing profession.
My goodness, it's a global wish. Wherever you are on the planet, I think all of us have that same wish. Because the year of the nurse and the midwife, we were, the plan was to showcase our talent, to celebrate the difference we made. It wasn't the way we wanted to celebrate, but COVID actually helped us because the world had to take notice that, who are these selfless people, supporting people, despite the challenges, despite their fears and anxieties of contracting this disease. Because I know, especially around Ebola, how people were terrified. I remember my uncle, and I was speaking with him over the phone. He lives in Lagos. And I said, "Oh, uncle, with the Ebola, I don't shake anybody's hand. I don't shake." I'm like, and I'm going, how? Why? He was so anxious because one of my cousins at the time was a nurse in Nigeria. And he was like, you don't want to do nursing. Try and retire quickly so you don't die. So we know the great sacrifice we've made. But as you said, we've also had an opportunity to raise our profile, our status as nurses in the community. And with the nursing now as well, raising the profile of nursing around the globe. The strength of character we have, the knowledge we have, the skills we possess, we being experts in our own right within health. And no wonder you are proud to be a nurse. We just hope it doesn't remain, as you said, with just applauses. We want, yes, it's lovely to be applauded, but we need to be compensated. If people value us, then we must be compensated for the difference we continue to make. Well done. I love your wish, and I hope your wishes come true, because your wishes are my wishes too. Amazing. So it was also a year of celebration. How would you want us to celebrate? How would you want to celebrate the rest of the year?
I really would want nurses to aspire to positions of decision-making positions. I want nurses not just to be at the outcome. I want nurses to be part of the process. I want everyone who feels that nurses are doing the right thing to give nurses a chance to lead. Nurses should be in the decision-making position. They should be if we are at the forefront, when you want to make the decision, we should be at the forefront. That's how I want. Everyone who celebrates nurses should support nurses to lead, support nurses to be part of policy-making places and positions. I want nurses all over the world to see that they are not just at the outcome, to be part of the process, be involved, be part of that decision-making process, aspire to leadership position. That's how I want nurses to be celebrated.
I know what you mean, and I love what you've said. Because when we're needed, all of a sudden you want us to be in the front, yeah? But when it's time to make the decisions, you don't even want to listen or engage with us and value our expertise. If we're experts, we should not just be experts when it suits decision makers. We should be collectively making those decisions, because what we have is also insights into the challenges those we serve face. but also the better ways of working to ensure their improved outcomes for patients and whatever populations we serve. But for also for every single nurse to be given opportunities to lead, to be involved in policy making, to write policies, robust policies that will benefit many more people. Because as that inside, we understand how it works. We often have the greatest touch points with our patients, know what their needs are, what would help improve practice, what will make services more efficient and effective. So why do you pick and choose when you involve nurses? We should be involved every single bit on the table, processes, writing policies, implementing policies, every single area. We nurses and midwives, of course, because it was the year of the nurse and midwives, should be involved. Amazing. I hope that's the way we get to celebrate. But I also believe it comes with responsibility, because those who give power away don't always want to give it away. Those who hold the power don't always want to give that power away. So we may have to fight for that power so we're allowed to lead and allowed to be at that table so we can shape the delivery of care. I am inspired by your career story, how reading one article shaped your whole career, that this is the difference nurses make. Florence Nightingale, who is she? Her contribution to modern nursing. And 200 years after, in the year of the nurse and the midwife, you were able to make a massive difference to the populations you serve and other healthcare personnel, that you were recognized as one of the 100 women in global healthcare, nurses and midwives. Amazing. Well done. My aim now, as we get to the end of your interview, Edidiong, is to ensure everyone that watches your interview is just as inspired. What words of inspiration would you finish with?
Okay, I would like to inspire all nurses to whatever position, wherever the country they may be, they should do their best and to do it with passion. I would like to conclude with the words of the first professor of nursing, Mary Adelaide. She said that compassion may be the motive in nursing, but our only working power is knowledge. So if we want to keep moving ahead, that nurses should not should aspire to acquire the knowledge, should stay relevant, if acquire the necessary technological know-how. The world is changing, so nurses should keep to pace, do your work with passion, and know that whatever and wherever you are, the impact you are creating is important. It is this tiny impact that are summated and result to the overall picture of what we all are, global nurses. So that is my encouragement to all the nurses around the world, that they should do their best and do it with passion.
Wow, what powerful words. Do your best and do it with passion. Whatever position you hold, whatever your role is, do your best, do it with passion. But it's not enough to become passionate. You also have to acquire knowledge. Keep aspiring to growing knowledge, be responsive, keep abreast with evidence, use digital technologies, move with the times so that we can be more responsive to those we serve. Because sometimes we can't always see the impact, but those we serve know the difference we make. So keep doing your best. Thank you, Edidiong. I have really enjoyed hearing your story, but also sharing it, and keep doing your best like you encourage us to, despite the challenges. Thank you.
Thank you so much.
It's been a great pleasure. Thank you for listening to Nurses and Midwives Talk with Ruth Oshikanlu. See you on the next episode. Until then, take care.